immigration, then T with an overview. First, immigration, we're kicking it, answering the add-on first. First, on our underlined part of the card said that we need to address education to solve for human rights, and they didn't read an impact card. Don't give them any leeway to read a new one, so use the block strategies. Now onto the T overview. Extender Pollack et al. In 94 evidence social services are distinct from healthcare because social services are directed to create the well-being for society, while health services are meant to create health well-being. This is the best definition for debate because it's broad enough to allow a large number of affirmatives, including veterans, weatherization, immigration, technology, and Native Americans, preserving fairness and topic education. Prefer this definition. The ASA point is limits definition of social services inclusive of healthcare include the entire second place resolution. Extender Stanley evidence healthcare policy is so complex and multifaceted and varied that it allows a wide range of new affirmatives such as single-payer systems, Medicare and Medicaid reform, organ donors, biotech assistance, and family planning, destroying the topic as specific education about social services because it kills our ability as future policymakers to enact the most effective social services later in life. And the visa point is precision. Our definition is the most predictable, limited definition on the topic. It's both a governmental definition, Extender Department for Health and Human Services evidence, which indicates that prevention would not be termed a social service, and it's the most rigorous definition. Extender Frank and Dawson evidence that indicates that private insurers have made sure that the definition for social services is the most rigorous. The quality of limited predictable definition means it's the most anticipated in the context debate. It's impossible to predict. Healthcare Act, which destroys any internal link to education. Now onto the line by line. First, they say we can see the counterinterpretation, but first, the block gets to make new arguments, skews our ability to win T, otherwise doesn't let us prove abuse. And two, we can see you have a counterinterpretation, just not that you get to make that we don't get to do comparison. Then they say that social services means that federal poverty programs. But first, this definition is cut out of context and includes 29 different broad categories, including the category not limited to that list. Multiply that by the number of subcategories. It's impossible for you to predict affirmative cases that's impacted above, and you don't meet your counterinterpretation. Health services only emergency care, and that's already offered to immigrants. And then they say that social services are Medicaid, but first this is extended in the 2AC. They only extend the counterinterpretation, and even if you give them access to that, this is contextual, makes ridiculous cases like Twitter. That's Ruble and 9. Twitter is a social service for people to communicate, and chat rooms that cater in Hamburg and 7. Social services include chat rooms and real-time messaging online, and the CISA point is happiness. That's Du Bois in 1982. Happiness and temptation for the reason the expression is a social service, and this is not limited or predictable. Lack of exclusive quality means that everything is potentially topical, and the listing of one social services means no one can predict. It has a definition that's impacted above. Then they say precision, but first we have the highest quality definition, which is their internal link to the precision impacts. Only ours explains why the distinction between medical and social services and utilizes a federal definition. It means we access both their internal links, the true predictability the best, and their definition defines social services as 29 different broad categories, including other means that even if we know the definition, we can't use it as a jumping off point for research, means it's insanely unpredictable in the context of debate. Then they say over-limiting, but first our definition provides a wide variety of affirmatives as shown in the case list, but they destroy any way that the negative can conduct in-depth research. Since our Brown, the evidence, the health sector is the biggest sector of the economy, literally the widest topic we could look at, and small limits are good. Key to real-world education, skimmed over knowledge is good for nothing but trivial pursuit. Only an in-depth look at the topic is how we can actually do anything for real world as a policymaker in the future. Now into my standards. First, they say our definition isn't precise because it's not governmental, but precision's a pipe dream. There are many government definitions. There is no reason why theirs is uniquely best for topic. Only the most limited government definition, like ours, would be predicted in the context of debate because it uniquely has qualities for that. And then they say that healthcare is one sector, which means it's not large, but the number of subsets in that one sector are enormous. Healthcare is a huge topic that has a number of potential cases. That was in the overview, still explodes limits. Then they say that Stanley is just some lazy editor, but it doesn't matter. He doesn't want to talk about healthcare. The reason behind it is healthcare is so complex and diverse around the country. It's critical for evaluating the topicality debate because it's impossible for us to get in-depth research that's impacted above. Then they say reasonability, but potential abuse is a voting issue only by framing the topic in a useful way possible for debate to become relevant. Their question of competing interpretations destroying fairness begs the question of why fairness in education is good only by setting up the topic in a way that departs useful education. Does debate matter at all? And reasonability causes judge intervention. The negatives left wondering what is the threshold for in-round abuse that is a voter. Only in strict line-by-line interpretation of what is a voter is possible to preserve debate, and there's no race to the bottom. They can just argue over limiting back. The negative needs to prove why limits they provide for the topic are uniquely key.